Welcome to your weekly checkup. I'm Dr. Jonathan Lazar.
And I'm Jaden Lazar. We're so glad that you're here today. So, today's topic hits really close to home for so many people, especially those who are still searching for answers. So, today we're talking about POTS, postural orthostatic tachycardia syndrome.
If you've ever felt lightheaded, dizzy, or like you might faint every time you stand up, or if your heart races for no reason at all, this show is for you. And if you're a parent of a teen who's constantly fatigued or misdiagnosed with anxiety, stay with us. So let's break it down. POTS is a form of dysautonomia, which means your autonomic nervous system, the part of your body that controls your automatic functions like heart rate, blood pressure, digestion, that's out of balance.
So, POTS is often misunderstood. It's not just anxiety, it's not just low blood sugar, and it's not all in your head. In fact, many of our patients have actually seen cardiologists, neurologists, and even psychologists before coming to us, and they still didn't feel better or have any answers.
Exactly. The hallmark sign is a heart rate increase of 30 or more beats per minute or over 120 beats total within 10 minutes of standing without a drop in blood pressure. So you have to stand up, and if your heart rate shoots up 30 beats a minute or more, or it goes over 120 within 10 minutes of you standing and your blood pressure does not drop, the definition of POTS. Now that's different from orthostatic hypotension, where the blood pressure drops. POTS often comes with things like fatigue, brain fog, nausea, chest pain, shaking, migraines, gut issues. Sound familiar?
We also see a lot of young women, specifically between the ages of 15 and 35, who are affected. Although it can happen to anyone, there's often some type of trigger like a viral infection, concussion, pregnancy, and even trauma, including birth trauma.
Also, trauma does not have to be physical. I think it's important we mention that because it does not have to be physical trauma. Now, we'll explain what's really happening and especially how brainstem pressure and upper cervical misalignments can affect baroreceptor signaling, which is part of the nervous system, vagus nerve tone. Everybody's hearing about vagus nerve now, vagal tone, and blood vessel regulation.
So if this is already sounding like you or someone you know, don't go anywhere. We're going to explain what most doctors are actually missing and what can actually help.
This is your weekly checkup. Our number is 866-521-WELL, 866-521-9355. We're going to take a short break. We'll be back right after this. Welcome back to your weekly checkup. I'm Dr. Lazar.
And I'm Jaden.
One of the biggest issues we see involving POTS, this vertigo, fatigue, chronic fatigue, these unknown things. People aren't quite sure what they are, but they're feeling weird, but nothing is showing up on testing. We see neurological dysregulation at the brainstem level, just essentially between your ears. Think of it like a kink in the body's circuit breaker. So even a subtle misalignment in the upper neck, the upper cervical spine, which we detect with advanced 3D imaging and scanning, that can throw off everything from your heart rate to digestion to hormonal function.
So this is where our specialty, Dr. Lazar's specialty, comes in. Using the QSM3, it's an upper cervical approach.
You're studying QSM3 though. Yeah, anyway. And she's good, by the way.
I'm better.
Okay.
But QSM3 stands for Quantum Spinal Mechanics. It's an upper cervical approach, and we're able to gently remove the interference from your body so that your body can heal how it's supposed to on its own without popping, cracking, twisting, or forcefully manipulating the spine.
Yeah, it's also really, really precise. So there was a young lady that was in just yesterday, actually, and the misalignment she had when we calculated that was remarkably consistent with what we would see. And she recently, about a year ago, lost vision in her right eye, and then it started affecting the left eye. And then she started getting migraines around the same time. and the left side of her body goes numb. We could see crystal clear with the assessment what was going on and how we can help her. We've seen patients who couldn't walk across a room without blacking out, now back in school, playing sports, working again. It's not magic. It's restoring upper cervical neurological tone and autonomic regulation. There was a young lady, she's married now and has a family, but when she was in high school, she was dealing with stuff like this, and she was on the rowing team in high school, and there were times she blacked out and just fell into the water, like off the dock into the water. It was a really scary thing. She hasn't had episodes in years, but that was a really scary time for them.
It's also important to note that many patients with POTS feel dismissed.
That's huge.
And they say, well, your labs look normal, or there's some tests that are inconclusive, or you just need to hydrate more, or take this medicine or these beta blockers, but that's not enough.
We believe in listening deeply and validating what patients are experiencing. It's not just stress. It is stress, but it's not just that. It's not just that you're stressed out and it will calm down when circumstances you can't control change. It's a real physiological issue, and it deserves real help. If you're just tuning in, we're talking about your health issues, POTS, or positional orthostatic tachycardia syndrome, where people feel lightheaded or faint when they change positions. We're going to take a short break. We'll be back right after this. Welcome back to Your Weekly Checkup. I'm Dr. Lazar with Jaden, and we're talking about POTS, that fainting, losing balance, feeling dizzy when you change positions, and tests are inconclusive and you're not sure what to do. That's what we're talking about.
Yeah, so I want to share a story. So one of our patients, she was 17. She was misdiagnosed with panic attacks. Every time she stood up, her heart would race, she'd collapse. After just a couple months of care, she's not only standing without dizziness, she's thriving. She's not on her anxiety medication and, telling her to drink more water and everything like that. Her body's working the way it's supposed to.
That's huge. And what sucks about people being told it's just a panic attack are they're not addressing what's actually going on. And so now the problem is actually getting worse because it's not being addressed. It's being ignored or swept under the rug. Remember that nurse, she was in her 40s. She thought she'd have to quit her job, kept pass out at work, and was afraid of symptoms. And her symptoms started after a car accident. No surprise, but people don't connect that a lot of times. Turns out her brainstem had shifted slightly forward, and there was a misalignment there at the top of the neck where the skull sits on the neck. That was putting pressure on her vagus nerve and disrupting her body's ability to regulate blood flow. She's having the syncope or the pass out attack. She's having migraine. She's having gut issues. And they're like, it's vertigo. No, it's chronic fatigue. No, it's stress. No, you're environmentally exposed. And the issue with her was she had pressure on the brainstem. And you know what? We miss 100% of what we're not looking for. So if they're looking for other stuff and it's brainstem pressure, they're not going to find it. And we say all the time, you can't out-medicate brainstem pressure. You can't do it.
These stories, these are why we do what we do. We're not just offering relief. We're giving people their lives back. We're fixing the problem. We're moving the interference, and we're not just covering it up.
Yeah, that's huge. And it's not just chiropractic care. That's the most powerful, the most important, the most fundamental, because if your nervous system isn't working, nothing is going to work. But we also combine it with advanced scans that we do, neurologic testing, soft wave TRT, customized supplement protocols, at-home recovery plans. We have online courses you can take to do at home, or if you're not able to come for one of our intensive programs or you don't live locally. So healing happens 24/7. It doesn't mean you have to get adjusted by us all the time for it to work. That is what gets us the best results, but we do have other options. So any questions on that, give us a call, 866-521-WELL, 866-521-9355. And if you're seeing this online, just leave a comment below and we'll get with you and see how we can help.
If you're hearing this and you're wondering if we can help you, please don't wait. You can schedule a consultation at lazarspinalcare.com, or you can call us directly, 866-521-WELL. That's 866-521-9355. The consultation is simple. It could be the turning point that you've been waiting for.
We're going to take a short break. We'll be back right after this. Welcome back to your weekly checkup. We believe that your body was designed to heal. And even if you've been told there's no solution, there may still be hope. I was just talking to a couple from Chicago that came in for an intensive, and we built an entire method around this idea. It's called the Lazar method. And we did that to uncover the root cause and restore function naturally. This couple is getting the help they need. They got some here, they're getting some remotely, and then they're getting some locally where they are. And we're really proud to be able to offer that, because over the years, we've realized not everybody is in our backyard.
So if you're just tuning in, we are talking about POTS. And if you've missed any part of the show, that you can catch it, the whole show, on our YouTube channel, as well as our podcast and our radio show.
And we'd love to meet you, whether you're here in Michigan or flying in from across the country. We offer both in-person evaluations and remote pre-screening calls to see if any of our programs are right for you.
So if you're a parent, you're a spouse, or a friend of someone who's dealing with unexplained fainting, rapid heartbeat, extreme fatigue, share this episode with them. You could change their life.
Absolutely. And keep this in mind. Your body is brilliant. It's not broken. I know you're led to believe that. Let us help you find out what's going on and what's getting in the way of your body's ability to heal. Welcome back to your weekly checkup. I'm Dr. Lazar, and we're talking about POTS, the scale of this positional orthostatic tachycardia syndrome. Here's why it matters. So pre-pandemic, POTS affected 0.2 to 1% of the U.S. population, approximately 1 to 3 million Americans. The onset age and gender most commonly hits between ages 12 and 50, with a 4-to-1 female to male ratio. So ladies, this affects you a lot more than guys. Now, post-COVID surge, the University of Toledo study found that monthly diagnoses jumped from around 4 to 22 a month, a 5 times increase from March 2020 to June of 2024. So there's definitely a factor there. And roughly 20 million people worldwide are now estimated to have POTS post-COVID, with 30% of long COVID sufferers showing these POTS-like symptoms where people are passing out, falling over as they're changing positions. Now, what the research reveals is kind of this comorbid web. A staggering 40% of people with POTS report migraines along with it. 30% of people report irritable bowel syndrome. 25% have a comorbidity or another diagnosis with something called Ehlers-Danlos syndrome. It's a genetic connective tissue disorder. It affects collagen, or the glue that holds your body together. So what they experience are these hypermobile joints. They're double jointed, or they deal with frequent dislocations, frequent sprains. They have stretchy, fragile skin. They bruise easily. They experience slow wound healing, chronic joint and muscle pain. Sometimes it affects internal organs as well, and blood vessels or digestion. And, people will say, well, what does connective tissue have to do with POTS? Well, collagen helps support blood vessels. And so in EDS, or Ehlers-Danlos syndrome, especially the hypermobile type where they're too flexible, veins can become too stretchy, and then that allows blood to pool in the legs when they're standing, which is a major trigger for POTS symptoms. 21% of people report having ME, or myalgic encephalomyelitis, also known as chronic fatigue syndrome. That's a really complex chronic illness, and it's marked by profound fatigue that does not improve with rest. It involves post-exertional malaise, PEM, which is a crash in function after minor physical or mental activity. It feels like they ran a marathon and they really just walked to the bathroom type thing. It involves sleep disturbances, brain fog, memory issues, pain, of course, headaches, and then orthostatic intolerance. They can't often tolerate an upright posture, so they've got to lay down a lot. Up to 40% of patients with this ME or CFS also meet the criteria for POTS. And some researchers actually believe POTS may be a subset or autonomic branch of this ME or CFS. Both often develop after viral infections, and common ones are Epstein-Barr or COVID-19. We call those comorbidities, where multiple things are happening at the same time. 20% of people with POTS also have fibromyalgia, 16% have anemia, 9% have mast cell activation syndrome. So you're seeing that it's just this web of the body not regulating itself. Celiac disease, where they can't come in contact with gluten at all, is 4 times more common in POTS patients versus the general population. There also are some autoimmune underpinnings that go on with this. And keep in mind, your immune system is controlled by the nervous system. So there's definitely a connection there with this dysautonomia, this dysregulation aspect of it. Antibodies that target what's called alpha-1 adrenergic or muscarinic M4 receptors, those names don't really matter, but those are frequently present, and that drives autonomic dysfunction. Experimental treatments like immunomodulation and REGN 7544, those are now in double-blind trials across 10 states in the US and in Canada to see if modulating the immune system will affect people with POTS. Now, there are predictive biomarkers and there's personalized care as well. Research highlights that predictive power of the baroreflex sensitivity, which is a neurological phenomenon, and 24-hour urinary sodium in tailoring treatments like oral rehydration salts. That's big. So if you've been told, hey, put a pinch of salt in your drinks and things, that is helping people with this. If you're just tuning in, this is Your Weekly Checkup. I'm Dr. Lazar. We're talking about POTS, or positional orthostatic tachycardia syndrome. We're going to take a short break. Be back right after this. Welcome back to Your Weekly Checkup. I'm Dr. Lazar. Our number is 866-521-WELL, 866-521-9355. And if you're seeing this online and have questions, you can leave a comment below. If you have dealt with any of these symptoms, just give a yes in the comments and we can discuss further. Now, there are some trends that are shaping awareness of this, which is cool. So the NIH, National Institute of Health, and Johns Hopkins are spotlighting POTS clinic models and recognition of the disorder's autoimmune nature. Also, media coverage of POTS surged starting in 2023, spotlighting intersecting conditions like long COVID with POTS. So it's starting to catch some attention, and, we've been working with it for years, but sometimes people aren't aware or aren't ready to see that. There are some real life scenarios. There was a 16-year-old girl with POTS and Ehlers-Danlos and MCAS. She regained full schooling attendance after this tailored autonomic and upper cervical chiropractic care. We did her care. She had some at-home stuff that she could do to help reset her autonomic nervous system, and really, really great results. Full school attendance as soon as we got her through this. That's a super misunderstood situation. So by the time people are getting here, they've been places and haven't gotten a lot of answers. It's super misunderstood, but it's highly relevant, especially in patients with POTS and Ehlers-Danlos and chronic fatigue and ME. What happens is the mast cells, which are a type of white blood cells involved in immune defense and in allergic reactions, they release chemicals like histamine. So if you take allergy medication that's an antihistamine, for example, they release that histamine inappropriately. They release it too much, even without an allergen present. Now, mast cells normally, when they're functioning normally, they're part of your immune system. They're found in tissues like the skin, respiratory tract, GI tract, blood vessels, brain, and they respond to injury, to infection. When you're exposed to allergens, they release histamine, tryptase, cytokines, prostaglandins, and that triggers inflammation or immune responses. So those are the messengers that get the immune system engaged. But in mast cell activation syndrome, the cells are constantly misfiring. And so there are symptoms all over the body constantly. Now, the symptoms of this flare unpredictably, often overlapping with POTS and Ehlers-Danlos or EDS. So in mast cell activation syndrome, if it's affecting the skin, there can be hives, flushing, itching, rashes, temperature intolerance. If it's affecting the GI tract or the gut, that could be nausea, bloating, diarrhea, cramping. That's really often misdiagnosed as irritable bowel syndrome or IBS. It's very often mixed up with other things. There are cardiovascular symptoms like dizziness, fainting, these POTS-like episodes, heart palpitations. But for the respiratory system, there's wheezing, shortness of breath, a feeling of throat tightness. Neurologically, people will experience brain fog, headaches, anxiety, light or sound sensitivity. And then in extreme cases, there can be anaphylaxis where the body just goes into shock, really strong allergic reactions, menstrual irregularities. Those are common because the tie is with the nervous system. 33 to 50% of people with POTS also meet the criteria for mast cell activation syndrome. If people have hypermobile EDS, Ehlers-Danlos, they often have leaky blood vessels, which can allow mast cells to release mediators into the surrounding tissue more easily. And then those flares can worsen the autonomic symptoms. So the heart rate spikes, the GI distress happens, fatigue happens, and that can mimic or aggravate POTS episodes. Going on a little tangent with the MCAS, it can notoriously be hard to diagnose because the symptoms vary. They're all over the place. Blood vessel tests like serum tryptase or histamine metabolites often need to be taken during a flare. So if it's not an active flare-up, then the lab work is going to look normal, which is such a hallmark sign. People either tell us all the time, my lab work is normal, or they're finding things on the lab work, but they can't figure out what it is. And it's tough with this because there's no single test. Diagnosis is usually based on clinical history, lab markers, symptom relief from whatever treatments are being sought. Some common treatments are antihistamines, so H1 blockers, H2 blockers, mast cell stabilizers, cromolyn sodium, quercetin, those can stabilize mast cells. There are low histamine diets, those reduce flare triggers, and then avoiding triggers like heat, alcohol, fragrance, stress, food additives. But how do you avoid those? I mean, those are everywhere. So when talking about mast cell activation syndrome is where mast cells release chemicals too easily, and then that causes widespread inflammation. People that commonly experience it have POTS, Ehlers-Danlos, chronic fatigue, long COVID, ME, and the diagnosis is made by clinical symptoms and response to medications. There are specialized labs, but those, aren't typically the first 10 that are ordered. Conventionally, they'll give people antihistamines, lifestyle changes, mast cell stabilizers, but that's not what we're talking about because we want to address it at its cause. So if we're experiencing these symptoms and we're not sure what they are, we don't do things like take antihistamines to cover up the symptoms because that's just the response. If your car was burning oil and you've got this black smoke out there, you don't just tape up the exhaust pipe, you find the cause of the problem. If you're just tuning in, this is your weekly checkup. We're going to take a short break and be back right after this. Welcome back to your weekly checkup. I'm Dr. Lazar. We're talking about positional orthostatic tachycardia syndrome or POTS, where people are fainting, falling over, can't change positions very easily without having these issues. It's an autonomic dysregulation, meaning your nervous system isn't working well, and we're focused on finding that interference and removing it so the nervous system works well. If you have questions about that and you're listening, our number is 866-521-WELL, 866-521-9355. And if you would like some information on this, you can text the word POTS, P-O-T-S, to 734-274-5107, 734-274-5107. Text the word POTS. and we'll follow up with some more information. There also was a frontline hero recently that we were helping with this. It's a nurse in her 40s, post-trauma, had severe blood pressure dysregulation. With the upper cervical intervention, with the care we did at the base of her skull, she was able to return to active nursing, which she was passionate about, certainly lost her passion with some compassion fatigue and this post-trauma and the blood pressure dysregulation all over the place. But she was able to get back and serve patients. And that was huge for her. That was very important for her. And then there was a long COVID patient after SARS-CoV-2 infection or COVID, 30-year-old developed nocturnal hypertension. So at night, the blood pressure was too high. And then during the daytime, hypotension, blood pressure was too low during the day. That's an informal POTS variant. They had done tilt training, compression, titrated medication. That was starting to change stuff, but it wasn't until we took pressure off the brainstem and then did some soft wave stem cell activation at the brainstem. Symptoms reduced by about 70% within the first 3 months. So it's important that early detection happens. Diagnosis delay averages 4.7 years, with patients often seeing 7 doctors before identification. That probably is already you, but if it's not, don't let it get to that point. Let us help you with this either in the office or virtually. And prognosis improves with care. So about 90% of people respond positively to combined types of care, and up to 60% have fully returned to pre-illness function within 5 years. And there's a post-COVID urgency. I mean, with POTS now, one of the most common long COVID complications, awareness and quick triage are super essential for that. So if standing causes an increase of 20 beats per minute within 10 minutes of standing, or for adults, or 40 beats per minute in teens, or when you're standing, your heart rate goes above 120, but your blood pressure doesn't drop, pay attention to that. And if you have symptoms like brain fog, nausea, chest pain, definitely seek help for that. We can evaluate and see if that's what's going on with you. Insist on a proper workup. Hydration and a high sodium diet can help. Salt tablets, electrolyte drinks, adding salt to drinks can help. Compression garments that can combat blood pooling, graded exercise programs where you start reclined and then progress slowly, like CHOP programs, for example. But for complex situations or those with upper cervical misalignments, this specialized care like QSM3 and Lazar method can restore autonomic function. If you have joint pain as well, that's a big factor. We're launching our hashtag POTS now, public awareness push. And so we're going to be doing free screening events, partnership with major long COVID networks. We'll have some mini segments with some guests, researchers, advocacy groups. And then here's a challenge. Have someone stand for 10 minutes. If they spike heart rate or feel dizzy, encourage them to seek help. You can help them with that. If this resonates with you or someone you know, go to drlazar.com, drlazar.com, and don't wait for your symptoms to get worse. Act now. So listen, POTS is real, fixable. It's rising fast, especially after COVID. With early recognition, a team-based approach, innovative upper cervical care, people are reclaiming their lives, but only if we talk about it now. This has been your weekly checkup, 866-521-WELL, 866-521-9355. Have a blessed week.